Hi, I'm making this video just to give people a little background about the surgery I had a month ago. I had a turbinate reduction surgery with a septoplasty, and this was done in an office setting. But I guess I'll give you a little bit background about why I had the surgery done. I got COVID about a year and a half ago, and I kept getting sinus infections. And my turbinates were swelling. Specifically, my left one was swelling so bad that I couldn't breathe at all out of the left side of my nose for almost about a year and a half. I tried everything. I did about 5 rounds of steroids and probably about 7 rounds of antibiotics before I decided to do the surgery. And I'd always had an issue with the left side of my nose for about 10 years with it being really congested. I've been having to sleep on my right side for about the last 10 years. So I guess that was one of the reasons why I decided to go ahead and have this surgery, is I thought maybe it would alleviate that and I could actually sleep on the left side, on my left side. Um, but I was just getting sick over and over again for about a year and a half. And on top of it, I got asthma and COPD as a result of getting COVID, and it attacked my lungs. But I had met with an ENT, and he told me that the ENT that didn't do my surgery, I saw a couple. I saw three ENTs before I went to the ENT that did my surgery, and he warned me against doing this surgery. He said that there was my turbinates were there was plenty of space, plenty of airflow. And he didn't think I needed the surgery. Um, but I guess I went ahead and did it anyways because I was getting no relief from nasal sprays. I tried Flonase, I tried Zyrtec, Allegra, and I got allergic rhinitis from the overuse of the nasal sprays. Um, so nothing was working for me, and so, I guess I went and saw a different ENT and he did treatment. And we did about almost 2 months of treatment. And I was seeing a significant improvement. About a week before the surgery, I was actually starting to get improvement with my congestion. And I contemplated canceling the surgery. I was so scared about getting empty nose syndrome. And I wish I would have never had the surgery done. Um, Immediately when I took the packing out of my nose, I knew there was something wrong. After I had my surgery, my left side was just completely wide open. Um, so I'm going into week 5 now, of post-op, and I know it's kind of soon to be making this kind of video, but I think people need to know about the risks of ENS. I don't think it's ever, unless your life is in danger, don't ever have turbinate reduction surgery unless it's life threatening. That would be the only way I would ever recommend it. I've lost my job due to all the issues I've been having since having the surgery. I had to quit my job. The doctor said I would be back to work in like 3 or 4 days. Um, that's not the case. Don't ever let a doctor tell you it's going to be 3 or 4 days because that's not the truth. So I had to end up quitting my job. Um, I'm not even sure if I'm going to be able to continue to work because of the symptoms I'm having. Right now, it's even hard for me to talk as I'm losing my breath. Um, because with ENS, I believe I have ENS on the left side and my left side of my nose. It's very dry. I have to every hour I have to put a nasal gel in there. Um, I always feel like I'm suffocating, which is a symptom of empty nose syndrome. And there's many other symptoms I'm experiencing from this surgery, and I hope it's going to heal. I pray to God it's going to heal. I know I'm only into week 5 now, but I had to quit my job, and I'm actually on a bunch of anxiety medication now, antipsychotic medication, depression medication, as a result of this surgery. Um, so just please, please, if you ever decide, please just research empty nose syndrome and research what your turbinates have many functions. Your turbinates, they warm the air that come into your nose, it humidifies the air. They produce the mucus in your nose and they regulate your breathing. That's why I would say never ever have a turbinate reduction surgery unless it's life threatening, because it regulates your breathing. And I had asthma, which I didn't consider, which was my fault. Um, I really should have thought about how my asthma was going to play out with the surgery. But if you have asthma, anxiety, do not get a turbinate reduction surgery. Never get it. And like I said, unless it's a life-threatening deal, because if you get empty nose syndrome, your life will never be the same again. I'm not going to say your life's going to be over, but from what I've read about what people have gone through with ENS is most people would rather die. Um, and I know a lot of people commit suicide after getting ENS, but I'm going to end this video now because I'm losing my breath. I'm sure I'm going to get a lot of, different comments on it, and that's okay. This is just my experience, and I hope, I just don't want anybody else to ever have this kind of outcome that I had. Thank you for listening.